Hello, and welcome to another episode of this YouTube channel. My name is Dr. Najmun Riyaz. I'm a practicing psychiatrist in the state of New Jersey. I also empower people in workforce, especially women in healthcare, working moms, as well as folks in IT fields. Through my podcast, YouTube channel, and blogs, I love to raise awareness of the importance of our emotional and mental well-being. Today, in this video, we're going to talk about how you, as consumers, clients, or patients, as we say in simpler terms, can hold your providers accountable to a good or a high standard of care that you all deserve and should demand. By providers, I mean doctors, physicians, assistants, and nurse practitioners, those who diagnose an illness and prescribe medications. I remember those good old times when we used to go to see a doctor and half of our ailment was just gone by speaking with them. The doctor would sit with you, look into your eyes, have a conversation with you, and we would feel heard and reassured. There was this, trust between the doctor or a nurse practitioner and a patient. But now with this managed care and so many regulations, electronic record keeping, and this constant pressure on providers to see as many patients as they can in one day, somewhere that patient-provider relationship has been compromised to a lot of extent. We know that all these regulations are in place to ensure that our patients get a standard of care, but sometimes it also brings unnecessary stress on providers. And then top it off with this background anxiety and worry that many providers feel of getting into this lawsuit in case they miss some important information or make an error of some sort during their patient interactions. Being in the role of a provider myself, and that too in my field of behavioral health, many times I have to take my hands off of that keyboard and take that stance of the good old doctor and give my patients that 100% fully undivided attention, which they have a full right to. The connection we built with each other is a very basis of that Hippocratic oath that we have taken as physicians or providers. But it also results in a lot of unfinished work, which then I have to take home, stay up late, and complete it. And that can put an extra stress on the lives of many of us providers. So it becomes an ongoing challenge. And I know, many as providers, we have to get better at finding that right balance. But that's a topic for some other day. In this video, I'm going to share with you guys as to how you as patients or clients can take charge of your own health and how you can hold your providers or organizations that you choose to obtain your care from accountable. You should and you have every right to demand a good and a thorough service from your providers. Why? Because you deserve it. You are worth it. You help run the systems. So first and foremost, discuss your diagnoses with your provider. Your provider is obligated to spend at least 45 minutes with you as an initial evaluation. They bill your insurance for at least 45 to 60 minutes of time with you. So if you notice that your provider hardly spent 15 minutes with you on that initial evaluation, then you need to speak to them about that. Ask them relevant questions, even when you see that they have run out of theirs. Ensure that your provider asks a detailed history about your past and present symptoms, list of your medications, allergies, family history, and all other pertinent health information. Now, before they decide to hand you the prescription, ask them as to what is their impression about your diagnoses. What made them come to this conclusion, and what does this mean for you? What is the prognosis? By prognosis, I mean the future course of your illness. How will it affect your work? What should you be aware of? How should you share this information with your family? Number 2, get detailed information about the medications you are prescribed. Never settle with saying yes to whatever medication your provider prescribes you. No one, and I mean no one, knows your body as good as you do. You have every right to ask the proper questions. You're putting such substances in your body which have brain-altering properties. Your brain, your mind, is that computer that runs your body. It determines your identity, your personality, your mood, your attitude, your ability to think, receive, and process all the information. So why would you expose your brain to a substance that you have no clue about? So ask your doctors questions. Why did they choose such and such medication? What are the side effects? What to expect and what to do in case such side effects are to arise. Read about the side effects. You don't have to obsess about them because the drug companies have to be very specific about even the tiniest side effect. But you should definitely be aware of the most common ones and the life-threatening ones. Inquire about how smoking, drinking, or any other recreational substance that you may be using will affect those medications. Notify your providers of any herbal or over-the-counter medications that you may be using and if it has any effect on your medications. Number 3, ways that you can communicate with your provider. Now, before you leave that provider's office, ensure that you ask them how can you get in touch with them in case you have any questions or you just don't feel right. And when should you expect them to get back to you? What is the method of communication that the doctor uses? Do they want to email you? Is there a portal that you can use? What about phone communications? And ask if those communications are confidential. Make sure that whatever medium you are using should maintain your confidentiality at all costs. Also, what is the expected time for them to get back to you? What do they recommend you do in case of an emergency? Should you go to an emergency room? Or is there any emergency service that they can utilize from the doctor's office, like an on-call provider and etc.? Number 4, inquire about medications which have abuse potential. When it comes to any substance that you are being prescribed which has a risk or potential for abuse, meaning a tendency where our bodies can become dependent on them, either physically or psychologically, then you need to be very careful about them and share all of your concerns with your provider. Physical dependence means when our body starts showing physical symptoms if we don't take the medicine on time or if we miss a one or multiple doses. And some of these symptoms can be like shaking, tremors, confusion, increased heart rate, body aches, nausea, vomiting, diarrhea, headaches, increase or decrease in blood pressure. And sometimes they can be very dangerous physical symptoms like seizures, which can become a medical emergency. And you may have to call 911 or go to a nearest emergency room. There are some painkillers like opiates or sedatives and some anti-anxiety medicine. For example, they come in the class of medicine called benzodiazepines, which can have such dangerous withdrawal symptoms, and that you should be fully aware of, even before you consent to taking such medications. That's why some of them are highly addictive. And then there is a psychologic dependence, means when you start getting emotional or cognitive symptoms if you miss doses or suddenly stop the medicine. It could range from like you feeling a low motivation, agitation, irritability, anxiety, depressed, changes in your appetite, moodiness, or just obsessing about the medicine, worrying that what if I run out early? What if the doctor stops prescribing? Counting pills, and so on and so forth. And there are many other emotional symptoms that can be associated with that psychological dependence. So even though it may not be as dangerous as the physical dependence, but it can be equally debilitating. Our bodies can also develop what's called a tolerance to some of these medications, meaning our body asks for more and more and higher doses as the time goes by, and the current dose is no longer effective. So we have to be very careful while taking such substances. That's why it's important that you ask your providers the right questions before saying yes to the medicine. Ask your doctor what the risks and benefits are, how long you have to take them, what to watch for, when does your doctor expect you to come off of them, and long-term side effects. What can you do in case you lose your medication or if you run out of these medicines? Hold your providers accountable for treating you with dignity and empathy. That's another important one. Ensure that they are making frequent eye contact with you during both the follow-up and the initial visit. As providers, I know we have to make a thorough documentation of every encounter with our clients, and time is very limited. But it's also important that we providers make our clients or our patients feel heard. So speak up, share with them in a nice way that you are not comfortable by having him or her not make any eye contact with you during your visits, and how that makes you feel. How you would appreciate if they could make a proper eye contact more frequently during the visit. Maintaining professionalism at all cost. Ensure that your providers maintains professionalism at all cost, meaning respecting your boundaries. Report to the patient advocate of the hospital if you notice that the provider was negligent or engaged in any behaviors that you think was not appropriate or that crossed your boundary. There are so many tragic stories that we hear in the news of doctors having molested their patients, which have had devastating impact on the patients' lives. So if you feel that the provider is not sensitive to your gender, your sexual orientation, your cultural values, race, background, or faith, report it to their staff or a patient advocate. When you leave the provider's office, ask if they have a survey that you can fill. Many times you will get a survey in your email. Make an attempt to fill that. That way, if indeed the provider is ignorant about certain sensitive issues, which we get, we're all humans and can make mistakes or we can be ignorant, but sharing it with the hospital system or the organization for which this provider is working for will ensure that they educate him or her or give them some extra training on such important patient-related matters. So basically, you'll be doing them a favor by giving them an opportunity to stay up to date with the current practices and policies. And also, if you feel very satisfied with your provider and feel that a provider gave you an excellent care, try to put in a good word for him. Or you can go ahead and write a good review so that you can help your other fellow humans in your communities to find great care as well. Please do not forget to do your part by following the recommendations of your healthcare providers. How? By taking good care of yourself, your own health, staying away from unhealthy practices, unhealthy substances, incorporating some activity in your daily life, eating healthy, taking medications on time, going for frequent checkups, and showing kindness to yourself, even if others don't. So stay safe, take care, and don't forget to subscribe to receive some more helpful tips on your emotional and mental well-being. So long.